I see someone who is really dedicated to her work, wearing a very intense mask here, and eye protection, and a gown, and her white coat's in the background. And so this is not a glamorous picture. This is a picture of someone who's working hard. I also see, a face and have to think about how do I, accurately depict this. I'm a hobby artist, but really what is so striking about this image of Abby is this intense mask. This is the front line of the COVID response, everyone. First and foremost, I'm a physician and a mom and a wife, I guess. I'm still a charcoal or pastel and paper person. I'm a full-time infectious disease provider at Denver Public Health. Yeah, I just kind of start sketching it out and making lots of little adjustments as we go. So this is Abby Laura, and she is a pulmonologist at CU Denver. So I am on the front lines and supporting my colleagues. And in my free time, I like to draw and paint. When I saw the New Yorker cover with the woman physician in her full PPE, and she was just FaceTiming with her husband and kids to say goodnight to them, it just reminded me of my own experience, and I felt like that's really cool. They're showing a woman and they're showing a family because, doctors and nurses and, technicians, we all have families. And then there was another really cool cover of a black man who was in his scrubs, and I just noticed that there weren't that many women of color being depicted as healthcare heroes, people who I don't think the society has really recognized and appreciated enough.
I was blown away when I was asked to deliver a selfie of me working on the front lines with respirators and masks and ways to protect ourselves in times of COVID, and that was a specific ask for women physicians and women physicians of color.
Called Women of Color on the Front Lines, and it's highlighting women physicians, but also we want to move into all healthcare providers who are Black, Indigenous, or women of color, and who are on the front lines of the COVID epidemic in healthcare.
There are women in medicine, there are people of color in medicine, but to dial down into being a woman physician of color in medicine in these times, that's a very special place to feel like you fit. And to then feel like, okay, oh great, this is someplace I fit. I never realized it was a thing. And then have someone say, oh no, this is a thing and we want a selfie of you doing your thing. And then to have it turn out like this is pretty amazing.
I just like the way it kind of shows that we're helping each other toward a common goal and working as a team, and that's really what healthcare is it's nothing without teamwork. And I think when George Floyd was murdered, it took on a new significance. It just took on a new meaning of how important it is to really recognize all of the work that we're all doing on the front lines, and women of color as well, women who are often discriminated against because of not only gender but also race or ethnicity. So I really felt like we have a duty to honor all of these women who are working so hard and really making themselves vulnerable for all of us.
I also realized that I checked all of those boxes, which is a very uncommon experience for me, especially being a Black female physician in Colorado, where I've been for over 20 years now. And so it appealed to me.
Black Lives Matter, and Black lives are saving all of our lives. They're in the ICU, they're delivering babies, they're in the emergency department, they're in the clinic. So really, yes, there are horrible things happening right now, and we need to talk about those things and we need to fix them. But we also need to recognize that, women of color are also heroes right now, and just really honor their sacrifice and their hard work and how far they've come and how much they contribute to making our whole society healthier. Pretty intense mask on. I feel like a responsibility in this time of renewed interest in racial and social justice to play a part, and I feel a responsibility to not only do this project and honor women of color, but also to continue to educate myself and to advocate in other ways as well.
The fact that it strikes me as unique and special is unique and special, because I don't think that that women physicians of color are portrayed in any meaningful fashion, and so for this to be being done in this particular medium and is touching.
If you're a white person and you care about racial justice, which I hope many people do, we can't settle for what we have done or how we feel, but we need to keep working hard and learning and reading and reaching out and doing more and more and more. So I feel like that's really everyone's responsibility.